Aqua Therapy is a great complement for somebody who has RSD. The benefits of the pool include several different factors. You've got the buoyancy of the water, which can help make the arms and legs relax. You've got the heat, the temperature, which makes the person's muscles more comfortable. And you've also got the tactile feedback of the water, which provides neurological input for someone so that they can feel better about movement. And the whole idea of being in the pool is it makes movement more comfortable. For people with RSD, movement is often very painful. So the pool provides a medium in which someone can exercise without having that kind of pain. For RSD, a pool would be a great complement to any land exercise program. It makes people feel good, you'll feel refreshed, and you won't have the effects of land and gravity on your joints. One of the benefits of the pool is that it provides support for the joints, and the constant fluid motion that you can achieve in a swimming pool is much different than what you can do on land. People who exercise on land are subject to possibility of muscle spasms, and they're not really supported the same way as they are in the pool. Try to lift those legs nice and high. There you go. That's it. Excellent. So we're going to do this for a few minutes. Do you have any pain while you're doing this?
Yes.
Okay. If it's hurting you, you can reduce the movement a little bit. If you're in the water and you're having pain, you can cut down on the motion a little bit.
Okay, just go slower.
Shouldn't be painful. You can slow down the life jacket, will give you enough support. Another thing you can do is you can do like a little bit of a scissor kick, and then you can switch to like a little bit of a frog kick.
Oh, like a breaststroke?
Right, exactly. Like a figure 8 motion.
That actually feels better than that.
Excellent.
Right.
So if you're doing a scissor and it hurts, you switch to a more comfortable kick, like a figure 8. You have to sort of experiment. So you can start walking back and forth here now. Excellent. So in the pool, you're able to tolerate much more weight on, much more walking in the pool than you would on land because of the reduced weight bearing. Okay, the next thing we're going to do is we're going to come on over here. You can stand on the side and start bringing your leg back and forth and out to the side.
Should I switch since I have both legs?
I would do both legs, alternating. I would do 10 on each leg before I switch. So maybe do 10 on each leg, correct? Okay, so the first one is going to be leg extension,
Do you
correct?
point or do you flex your foot?
I would do it straight for now. The foot doesn't matter.
Well, it's whether I have a tighter calf or not.
Right, we could do some stretching in the water, which would be a separate exercise. Perfect. We could also do like, we could do some mini squats, like up in the shallower water here, where she's in a chair, and she does rising from a chair. Like little sit to stands. That's a really good thing to do. Good.
Thank you, HSS, for your facilities.
We're going to use these dumbbells here, or floats, to do like a chest press motion, movement. Exactly. Perfect. Let's work on 10 of these. Now another movement we can do to stretch your shoulders and work on range of motion again is a fly motion. So you get your shoulders under the water. Exactly. You okay?
Yeah.
Too deep there for you?
No, this is fine, because I can actually move around, and this is good movement, whereas this arm I can kind of work like this.
Right.
And this arm I can move around.
Good. Okay. So once we've done a number of these, the next thing we can do is we can take these for a second from Varsha. What we're going to do is we're going to put the arms under the water and just try to lift them up and down using the buoyancy of the water to lift. The buoyancy of the water is going to lift your arms up and just lift them like this. Like, right, keep the shoulders low, right, and take advantage of the buoyancy. Bring them down to your legs. The advantage of the pool is that you can actually lift your arm without having to fight gravity. There's a buoyancy factor here. If you go faster, the water is going to provide resistance. Okay, so you don't want to go too fast, you just want to let them float up nice and easy. Now for Varsha, who's a little bit further along the healing process, she can use a prop here to hold and give her some resistance. Okay? So we're going to move our arms in and out. Right. Keep your elbow closer to your side so you can get advantage of the shoulder internal and external rotation that you want to work on. Right. Exactly. So you're coming in and out. Exactly. Okay? Okay, good. Perfect. So you're just reaching behind your back. Trying to reach up between your shoulder blades and bringing the arm back down. Beautiful. Perfect. Now a further exercise we can work on would be depressing your arms under the water, just pushing down and up. When you have to push up out of a chair, this is a motion that's very difficult for people due to pain and loading. Now we can give Varsha some hydrotones here, trying to push against resistance. Okay. So Varsha is going to push down against the water. Danielle is going to use her arms by themselves. Just keep them close to the body, the elbows, and push straight down, up and down like you're pushing out of a chair. Exactly. Imagine trying to do this against resistance on land. It would be a lot more uncomfortable. Perfect.
The warmth and the freedom and the fluidity of the motion really helps increase working on range of motion, getting those joints moving, and it just feels so much more comfortable, and it allows you to feel more inspired to keep going and making those strides that you need to do.
And I think if you keep working on your water exercises, over time you're going to be able to integrate that with land exercises. And in addition, the intermittent compression of water and then walking and then going in water is going to ultimately help solve this problem.